I have always thought if I ever had to have heart surgery or brain surgery, I would be absolutely terrified. And believe me, I was fearful. How well I did exceeded my expectations. I was treated for breast cancer in 1995, and during that period, my oncologist asked me if I knew that I had a heart murmur. And I did not know it. He's the first one that ever mentioned it to me. And after that, I had an echocardiogram, which showed that I had mitral valve prolapse, which a lot of people have, and most of the time it's insignificant, doesn't cause a problem. I subsequently went to my family doctor's office and saw the nurse practitioner that I usually see. So she sent me for another echocardiogram, which showed severe mitral regurgitation. She referred me to a cardiologist, and I chose to see Dr. Dagan here in town. She evaluated my echocardiogram and told me that my mitral valve disease was bad enough that it needed to be taken care of. Having been an operating room nurse, I knew a lot about surgery in general, although more minor surgery than heart surgery. And I also am very well aware that when you need any kind of surgery, but especially major surgery, the best place to go is someplace where they do a lot. I also knew that some heart surgery today could be done in a minimally invasive way between the ribs. So I asked Dr. Dagan if she thought that my mitral valve surgery could be done that way. And immediately she recommended Dr. Mumtaz in Harrisburg. He told me he felt that I could have a valve repair as opposed to a valve replacement, but that I had to be prepared to have a valve replacement if he felt that that was the best thing to do at the time of surgery. I was happy when I woke up. I think my first question was, could my valve be repaired? And I was very pleased to find out that that's what was done. I know that I did very well from the surgery. Right from the get-go, I progressed more rapidly than I thought I would. When that home health nurse came for the first visit, I answered the door, and she thought I looked so good that she thought I was the caregiver, not the patient. And I credit Dr. Mumtaz's good work with that. I was very pleased with Harrisburg Hospital. It was easy to get to, even though it's 70 miles. Some of what I had done preoperatively, which was my transesophageal echocardiogram, I also had a heart catheterization. Those things I could have done at West Shore. It was a straight shot up 81. I was very pleased with how the surgery went. Everybody was very professional, very kind, very friendly. You could tell that there was a lot of communication back and forth between caregivers. No one came into my room and said, well, why are you here? Or why am I seeing you today? Everybody knew about me. So this, of course, added to my confidence that everything was as it should be. I felt that I was in good hands. I could very highly recommend PinnacleHealth, and I could very highly recommend Dr. Mumtaz. I was exceedingly pleased with my care, with how well I did. Everything couldn't have been any better.